My name is Jenny. Um, I want to just first address, I think, the elephant in the room, which is the background. Um, I rather cleverly decided that I'd put a background app on for Christmas, and it's gone, and I don't know how to remove the apps. So I just keep having these amazing background apps, but they distract me a little bit. So I've tried to find the least busy one possible. But I want to know, why do you want a background in a bedroom? I'm not really sure. Maybe that's a question for somebody else to answer. But anyway, I wanted to kind of talk about a question I get asked a lot is, why do you still feel pain when you've had scans and you've had x-rays and they're coming up as normal? And you've tried lots of treatments, it's been months, maybe even years. Why are you still feeling pain? It's such a good question. Now, first of all, I think there's a lot of stuff out on Dr. Google um, suggesting that there's going to be one cause for your pain, therefore one fix. It doesn't work like that. Pain is quite complex. It's totally treatable, but it isn't something that's going to respond to you chasing around your symptoms. So if we're talking about now the type of pain that you've had maybe for several months, maybe even a few years, you might have had it on and off. You've tried lots of different treatments, and it's just not getting any better. And for some people, for a lot of people, it just gets worse. And I know that certainly, like me, if you're over 50, maybe 60 or 70s, other thing that happens is that you think, oh my God, is this it? Am I going to have to manage this for the rest of my life? Is it going to get worse as I get older? So much, so often I get asked about that. So just to address that, why do you still feel pain when there's nothing on any scans and that your everything's normal or your testing's normal? We used to think that you only had pain if there was something wrong with the tissue, muscle, joint, nerves, bones, capsules around the joint, anything in your body. And we used to think that the tissue or the structure would send a pain message to your brain, and your brain would receive it, and that's how you experience pain. It just, your brain just got the message and went, oh, I feel pain. But it doesn't work like that. That's a very old fashioned view of pain, but lots of health professionals still hold that kind of a view or something similar. But that's not what happens. What happens is, for people who've got pain that's been going on for longer than 3 months, roughly, give or take, is that we know the natural healing process for any injury will be done and dusted in that time. I mean, the healing process for most tissues is 6 weeks, but if you broke a big bone, you could expect it to be continue to heal for 12. And of course, your body, if you have an injury, you ruptured a Achilles tendon, or you had a cruciate ligament, which is in your knee, or you had surgery for a joint replacement, of course you're going to get slowly better over a period of time, 12 months, maybe even 18 months. But that makes sense because you've had something happen, you've had surgery, and it's recovering. That's not because it's not healing properly, or it's slow to heal, or it takes that long to heal. Healing's healing. But what happens is that we have specialist nerve cells in our body that can detect change in pressure and load and force. That is what's sending the messages. That's that specialist nerve endings are picking up change or increasing load or increasing demand on your tissues and send it up to your brain. But of course, in the state of you having had surgery, you'll get the messages and the brain will go, well, you'll know, well, that's to be expected, isn't it? It's perfectly normal. I would expect to be a bit discomfort. I've done more. I've pushed myself a bit harder. I've done more exercises. I'm walking further. I'm doing more. So you kind of can rationalize that. But if you haven't done anything and you're getting pain, then it's quite normal to think, what the hell's going on? And it doesn't mean that you aren't in pain. So your pain's very real. It doesn't matter what's causing it. Pain is real regardless. But what can happen is that your tissues or your nervous system, which either transmits the messages, or in your brain, which gives you pain and muscle spasm and stiffness and maybe inflammation, can become very sensitive. So it can, normal everyday stuff can become painful over time. Now imagine this cycle. You say you walk and you've done lots of walking, and then this one particular week or weekend you do more than you normally do, and say you've got back pain, but your back pain is normally managed, but you suddenly increase your activity and your back pain gets worse. It is perfectly natural to think you've overdone it and then you need to back off. So what you do is you might say to yourself for 2 or 3 weeks, or maybe slightly longer, I'm going to do less because my back's sore and I don't want to make it worse. Right. So you're managing your pain. But the problem is that the nerve endings that previously were used to you walking, I don't know, daily for half an hour, right? Now think when you try to return to that's maybe not something you should be doing, because it's on the back of a message that, oh, I've hurt my back, I better be careful, because you think that naturally. And also you've got family and friends that love you and you've had back problems before, they're naturally going to say to you, oh, just be a bit careful. But the thing is that those nerve endings can very quickly become sensitive to thinking that normal return to your 30-minute a day walk, right, having had a period of even a couple of weeks of not doing it, they can start to think, oh, so when they feel you moving around, they're like a bit like, is this okay? Is this safe? Should we be doing this? Oh, she's had back pain. Maybe we need to just protect her for a little bit longer. This is your nervous system and your brain. And before you know it, you're thinking to yourself, well, back's a bit sore. I'll give it a few more weeks. And then you try again. But of course, you become less, you've got more deconditioned, so less used to doing that movement. So your nervous system's becoming even more sensitive, thinking, oh, me shouldn't be doing this. And it becomes a vicious circle. So what do? You avoid the thing that makes you sore. But unfortunately, that's creating more of a problem in the long run, because you're making the nervous system think that that is dangerous, not you personally. You haven't done it. You're just doing what's logical and what other people tell you. But your brain gives you pain to protect you. But sometimes it can protect you when you don't need protecting, and it can protect you doing normal everyday stuff. But you can imagine how easy it is, isn't it? You can imagine how easily that you could get into that cycle of it's sore, I won't do it. But the less you do, the more sensitive you become, your nervous system becomes more protective, the less conditioned you are. And all of a sudden, I'm not walking much anymore. So people say to me, well, how do I break it? It hurts. Well, that's a great question, because it does hurt and the pain's real. But these really fantastic nerves, cells that can pick up that change in pressure and change in movement, die off within a week. So what I always suggest you to do, and if this is you watching, you're thinking you'd like to be able to do it, and it doesn't have to be about walking, it can be any activity. If you know that you can comfortably walk for 10 minutes at the moment, right, and you know that that's okay, then do 10 minutes every single day for a week. And at the end of the week, add on a minute or maybe two. And you do the extra, you do 11 or 12 minutes a day, every day consistently for a week. And then you add another minute on or another 2 minutes on. And what you do is every single week, you just increase it by a small percentage, give or take, depending on what your fitness level, what your pain's like. And what's happened is every single week, you're creating a new normal for your nervous system. And the more you do it and the more consistent you are, the less sensitive your nerves become. And the more they go, oh, this is right, we normally do this. And that's how you increase it gradually over time. So I hope you found that helpful. I don't want anyone managing their pain, because managing your pain means that you end up doing less and less. We need to challenge these beliefs. We need to challenge your body to do a bit more. And it's perfectly safe to do that. Just remember, pain is protection. All right. And even if you've got changes on your scan, it's still safe to walk and be active. The stronger we make our muscles, the more we move, the better it is for us anyway. If you want to ask me any questions, if you'd be interested in joining me on my 12-week program, where I work with people to help them improve their activity, get to grips with their pain, understand their body better, and basically help you to, move freely, heal fully, and live boldly, then please reach out and get in touch. I'll see you soon.